I was sitting at a red light one day. Next to me there was a family of 4 in a relatively old model van. That led me to think, what resources does a family like this have, particularly when it comes to purchasing health care? We're a community organization. We exist for families like this. And that our job, my job, and the job of everyone else in this organization is to work hard every day to make sure that families like this have access to affordable, high-quality health care. That's what drives me and everybody else in this organization on a day-to-day basis.
We had an appeal from a woman who was a young woman in her 40s, recently diagnosed with multiple myeloma. She had received conventional treatment for the disease, but it wasn't making a difference.
This member is terminal illness. We tried to help her as quickly as we could. In speaking with her, she had asked, you guys have to give me a last-ditch effort to try and participate in this clinical trial.
The dilemma we faced was the fact that the member's policy, through their employer, specifically stated experimental drugs were not a benefit. So, on the surface, it sounded like a pretty clear denial. But we knew there was something in the request we got from the oncologist that just said dig deeper.
So it was a Friday afternoon, and we were going to meet with the medical directors. And I think that we began our meeting at about 1 o'clock in the afternoon. And we met in Dr. Full's office.
So we gave a call into the oncologist and had a fantastic conversation. And learned so much more than we could have ever learned by simply looking at the paperwork that was in front of us. The choice was between using conventional chemotherapy, for which there was no proof that it would work in a case of multiple relapses, versus allowing this patient to be included in the very end of a phase 3 trial on a new and as yet unapproved FDA drug, which had been designed specifically for this purpose. And we finally came to the conclusion that the best treatment possible was going to be this new drug. And it was approved, and by 5 o'clock, and it took that long, it was about a 4-hour ordeal, I was able to call back the oncologist and say, it's a go for Monday, stay on schedule, you can administer the drug.
We all left that office that day knowing that as a health plan, we did the right thing for the member, and our hopes were that this put her in remission, and our prayers are with her every day.
Good for the Neighborhood is a monthly program that is brought out into selected neighborhoods that we found most at risk.
And I noticed that they had a sign-up sheet for Weight Watchers class. And I got all the information, found that it was free. So I went looking for my mother, who was in another area looking at some information. I called her over and I told her, sign the paper, we'll see what happens.
We provide health and wellness services to members of the community. Traditionally, we focus on members of the community that do not have insurance. They're either on Medicaid or they don't have any insurance at all.
So we went, and it was really, really nice. Information was great. It didn't seem like it was too hard to follow.
We learned to eat right, first of all, the do's and don'ts, and stay away from certain things that are not good for you. And in time, we've learned it does make you feel a lot better.
We benefited at the same time.
Yes, we did.
Getting healthy, losing weight, getting healthy, eating healthy, changing our habits at home with eating, changing the habits of the children. Instead of bringing them, the junk food that I usually bought for them, it was more fruits and, vegetables and more healthy things to eat.
We see these families on a monthly basis and we get to know them, their names, their faces. It's not a number, we know them personally. We get to know their children and their families and their grandparents. The ultimate goal is that, it's rewarding to all individuals that take part, because at the end of the day, they are healthier.
About a week ago, I received a call from a doctor's office. They were very upset. Actually, it was a nurse there. And she said, we have this mother and she really needs help. And we can't understand it, but she asked for help from another agency and they said she just didn't qualify. Can you help?
This case was a child who had multiple disabilities. She was very sick. She's not really able to get herself out of bed. Her mother is a single mom.
And because she has 3 other children, she really needed some help. She needed some respite care, and she needed to work with someone that she could really trust.
The home care agencies were just, again, having some difficulty understanding how complex this case was. So we really needed to bump the case up through a number of different calls. I think we made about 10 calls to different agencies about the case, about the family, and what could we really do to help. We were able to get multiple services into the home. We were able to get some, relief for Mom, which was what she really desperately needed.
Mom is delighted. She says that this is a great fit. The nurse is really helping her out. The child loves this nurse. It's a real fit. And she's able now to take care of all her children.
A couple of years ago, I was helping a member on the phone with some benefits and some medical care questions that he had. Since then, he's been calling me a couple times a year. His name is Al. And asks for the same type of help, whether he should see the doctor or not, or go to the podiatrist, and I go over his benefits with him and answer his questions. So a short while after speaking with Al the last time, I got a call from a woman asking for the same type of help, questions about medical care, benefits, whether she should see the doctor for something in particular, nothing unusual. And after speaking with her for several minutes, I said, well, let me have your independent health member ID number and I can look up your benefits more specifically so I know what kind of coverage you have. And that's when she said, oh, I don't have independent health. My neighbor Al told me to give you a call because you're always so helpful to him. So his neighbor was an independent health member. Maybe I helped her with one of her appointments or, her medical follow-up care.
The night of the storm, when it was cold and windy and snowing, Mike Hastings made sure that there was gas in the generator. We needed gas in the generator because our business would have been closed on that following Tuesday.
In the middle of the night, when I realized, holy moly, we're going to have a lot of snow. If we don't get fuel delivered, we would have been out of fuel probably by 4 or 5 o'clock the next day. The thing that really matters the most is keeping that pharmacy system going. For people to get their prescriptions, they want to be able to go into the pharmacy and know that independent health is still there. So keeping that pharmacy system running so that the drugstore can continue to dispense, was my number one concern.
People stayed in their houses, and Jim Wagner walked to work 5 miles.
I came in because I thought it was very important to get the message out to our customers. I know it was 5 miles. It doesn't seem very far to me, but I walked 5 miles in the snow to get here, to get the message out to the Pharmacy Benefit Management Group that are out in California, to customers that are in Florida on vacation or they're just snowbirds. I just wanted to make sure that they understood that we were under a travel advisory or having a snow emergency in Western New York.
I'm humbled to work with the people that I work with. We work with a great group of people who are caring and dedicated professionals. You don't find people like that every day.
I was in very serious trouble, but they settled me down and got me in ICU, and I was there for about 10 days until I was okay, and they decided to operate. And so I had triple bypass, and I was there for 5.5 weeks. I got home, and of all things, I get a nurse comes and see me from Independent Health. Then a physical therapist came saw me, taught me exercises. They were very nice. The nurse came a few times. The occupational therapist came, well, probably about 10 times. Taught me exercises, taught me how to walk, taught me to...
And really the beauty of Tom Martin's story is that it's something that happens every single day. It's not really out of the ordinary at all in our department. And I think all of the nurses in disease management are really passionate about what they do. And so, like Tom had said, you can really hear the caring in their voices when they make the outreach calls. And when we call people for whatever it is, certainly when somebody goes home from open heart surgery, we're not just calling like a disease like heart failure or diabetes. We're really, it's like calling a family member to say, hi, how are you doing? What can I do to help you?
People from Independent Health were so kind. You know, that's part of rebuilding your life, when somebody is so nice to you. And when somebody does so much for you, calling, writing letters, sending people, all that helps my family and me to get back to my health again. You know, that's hard to beat. You can't buy stuff like that. It's just something you don't expect, but it's wonderful to get.
At the end of the day, it's about making a difference in our patients' lives, making sure that they're comfortable, making sure that we've helped partner with them to find solutions to their health.
And so I called Independent Health and I said, I've never in my life had anybody treat me so nice.